Hip dysplasia afflicts millions of dogs each year, affecting all breeds. Here in today's Forever Family from the University of Illinois Veterinary Teaching Hospital, we have Dr. Monica Chin and Kelly Gard hanging out with us, as well as Hank. So welcome to everyone. Kelly, tell me about Hank.
Yeah, Hank is a 10-and-a-half-year-old American bully that I rescued 7 years ago. And he actually does have hip dysplasia currently, so it does affect him when he's walking. He's uncomfortable, so he actually puts more weight in his front limbs now because of it. So he ends up causing issues in the front legs as well.
Well, bless his little heart. So Dr. Chin, pitties are one breed that definitely is affected by this.
Yes, absolutely. So we typically think of hip dysplasia affecting large breed, giant breed dogs, German Shepherds being a large group, Golden Retrievers, Labradors, all the common breeds, Rottweilers as well. But absolutely any breed can get them, especially our pitties and other dogs. And so it does not exclude breeds.
Okay. You've actually brought a model here of a hip. So kind of talk us through what hip dysplasia is.
Yeah, so hip dysplasia is basically a congenital or developmental disorder where we start seeing some abnormalities at the hip, specifically the ball and socket joint. And what happens is that when they're young, they may seem normal, but they start out with potentially hip laxity, some abnormalities in the ligaments that predisposes them to subluxation over time, meaning that the ball and socket may not be really tight. Things might shift around there, and as that occurs over time period and you start doing regular activities, walking, things like that, it can cause cartilage damage over time period because of that subluxation. And so here I have what seems like a more normal femoral head as well as a socket, which is the acetabulum. It typically should sit in here and ambulate like this, but with hip laxity it basically displaces a little bit and then shifts back every time they walk.
And that probably is not very comfortable.
No, it doesn't. So over time period, we can start seeing some wear and tear at the level of the cartilage. We start seeing more inflammation, and we start seeing more joint pathology. And so over here, I have basically a sequela, a hip that has gone through these degenerative changes over time period. You see a lot of bony mineralization forming around the joint cap. So this is what it looks like when they have almost end stage arthritis.
Okay, so what did you notice about Hank here that made you think, okay, I think we may be having some hip issues?
Yeah, so I've noticed that he does have like a slight limp in both hind limbs. We've also taken x-rays. So it would have been nice to have the Pennhip when he was younger, when I first got him, because then we could have had a better idea of how bad his potential hip dysplasia is at that time, and then could have done some rehab or something like that, or potential surgery to help prevent the arthritis later on. But at this age, he's 10-and-a-half.
Yeah.
So he's already got the arthritis, unfortunately.
Yeah.
Yeah.
So, okay, so she mentioned an x-ray. Is that how we determine that's hip dysplasia, or how do we know for sure?
So with hip dysplasia, you can do genetic testing. There are some genetic studies out there, but unfortunately, that's not readily available. It's not very feasible, especially since there are different genetic, genotypes with different breeds. And so our next best way to determine or diagnose or assess for hip dysplasia is through radiographs or x-rays. And so there are many, many different ways to diagnose hip dysplasia. Pennhip is just one way. And I think at this point, we think that it's probably the most accurate when it comes to determining risks for determining arthritis in the future, just because it does kind of test for that laxity component that I had mentioned about before.
Okay, we're looking here about what is Pennhip, or we were just there. So it's an actual procedure to help with hip dysplasia.
It's a diagnostic tool that we have.
Okay.
Yeah. So basically, it's a way that we can radiographically determine what their relative risk in the future in regards to developing OA or arthritis, osteoarthritis for short. It looks at, first of all, the anatomy of the hips themselves. It also looks at the distraction index, which is what really helps us determine how much laxity there is is. And from there, depending on the breed and their population, because all these radiographs are submitted to the Pennhip organization, they can determine the relative risk for that patient to develop arthritis in the future.
Okay, we're about out of time. So what is the prognosis, treatment?
Yeah, so unfortunately, there really aren't many great treatments. If they're caught very young, right, so we can do the Pennhip as early as 16 weeks. If we can catch it at that time, yeah, we can potentially do some interventional surgery to maybe provide more conformational changes that will make them less painful from hip dysplasia. Otherwise, it is management once they get past that kind of young age. It is management until it is end-stage arthritis that they're dealing with, and we're talking about removing the femoral head or the socket, or even doing a total hip replacement.
Oh my goodness. So. Well, it's nice that we have options, though, to help our little furry friends here, though. Hank has just made himself at home here with us, and thank you so much for bringing him. Learning something new today. And if you want to learn more about what's happening with our friends at the U of I Vet Teaching Hospital and connect with Dr. Chen and her team, we will connect you at CILiving.tv.